Hey everybody, how are you? Sorry about the false start. It was me trying to learn how to do this, and I've got a lot to learn. Anyways, I'm at Homeless Healthcare, Los Angeles. This is Stephany, and we first connected, and what we're going to talk about first is the Hygiene spot, which is new on Skid Row. Want to tell me about the Hygiene spot?
Yes, so it's been called the Refresh Spot. It's a community-driven project. Spot. Yes, it is just...
I'm going by the subject and the email, Hygiene Center or something.
Yes, it is a hygiene center technically, and it's known as the Refresh Spot. It opened in December of last year, so it's been up and running for a little while now. It offers showers, toilets, hand washing, soon-to-be facility, laundry facilities for anyone who needs it in the community. So we're super excited about it. It's the first time, I was telling Mark, that public toilets have been brought into Skid Row in over a decade, so it's very much needed. And about 100 people a day are receiving services there. Well,
one of the things in that we were just talking about, it's the first time permanent toilets. I mean, not, there's shelters, there's mega shelters down there, but really accessible to people. The shelters, you have to wait in line, and there's all kinds, and the shelters are doing great. I'm just saying these are the first permanent toilets where you can just go up and do your business.
Yep. And you don't need to have, it's low threshold, anyone can come in. We ask for just your initials and, sorry, something's vibrating.
Oh, my phone must be going off. Yeah, somebody's calling.
For initials and why you're here, just to track some data. But you don't. I know with shelters, a lot of people have to be in the programs. None of that is. It's like that. You walk in, we give you the shower supplies, and then you're all set.
Yeah. And so part of this, maybe you were aware there was a hepatitis outbreak in San Diego. First off, you know what? I got to tell you, it's Skid Row. Maybe you are not familiar. Most people are. Stephany just informed me that there's 1,800 people outside at night.
Yeah, there's more. So there was a research that was conducted, and just to see what was really available in Skid Row in terms of hygiene, accessibility, public toilets, and we found there was 9 public toilets available in the overnight hours for the 1,800 people that are
9 toilets, 1,800 people. You do the math.
Yeah. So I've actually seen reports recently that say there's 18,000 people living in Skid Row.
Yeah.
It's probably counting the shelter, everything. Yeah. So it's not.
Well,
something in that range.
Yeah, so, homelessness, just by the nature of homelessness, is hard to count. As humans, we don't want to raise our hand and say we're different, we're homeless. So there's all kinds of other issues, and just counting is challenging. So whenever you hear a homeless count, it's at best a good guess. The numbers are a lot more. But Stephany's going to email me the research, and I will put it in the description of this video when I get back to the hotel, so you guys can all look at the research about toilets and hygiene. Can you talk a little bit more about that?
Yeah, absolutely. So it's a report called No Place to Go. It was an audit of public toilets in Skid Row. It was conducted, the audit, throughout January 2017. There was a team of different people going throughout the month, different hours, different areas, and we were looking at what was out there. So yeah, it's well below the UN refugee standards. It did pick up some international attention because it was pretty staggering. LA has the resources, so there's really no need why this is happening here. And we might be doing a follow-up report, but I think it was very telling, especially because about 2 months after the report came out, there was the Hep A outbreak in LA, and it did start, like Mark was saying, in San Diego, and then it hit Santa Cruz and then Los Angeles. So it's been San Diego was hit the hardest, but still, I mean, it's a public health crisis. That's what a Hep A outbreak is, because it's fecal contamination. That's how it's passed.
It's so important. Hygiene is, we all know, shower in the morning, brush your teeth, wear clean clothes. It's so important. When you're homeless, it's often a huge challenge. So
Exactly.
when there's services, now one thing Stephany just told me, and you may or may not know this, but in Skid Row there's these electronic toilets that you see in Europe a lot that kind of close. How many are there?
There's, I want to say 9 in
Yeah.
Skid Row, throughout Skid Row. One's a little closer to downtown. They're green, the automatic public toilets. They look kind of fancy.
Yeah, they're
You
really
look at them.
big, but they're closed at night.
They power down the overnight hours, and if like someone slams the door a little too hard, they just automatically power down. So there's always maintenance working on those continuously, and I don't think a lot of people are aware of that.
So a lot of you might be used to the live videos that I've done in the past where I can respond to comments right here, and somebody just wrote in Chinese, looks like, or hi bro, that part I got. I can't respond to the comments right now.
But thank you for putting those. Someone from Pakistan put a comment earlier, which is amazing.
So you're reading that. Good.
Yeah,
She has better eyesight. So if you feel like responding to people. But I would like you guys to let me know in the comments section, do you like this? This is the first time I've done it. Stephany is very gracious. The first time I've done it remote like this with a phone and just doing live interviews. So if you guys like this, write in the comments, and I'll do more as I travel around. So we're in the homeless healthcare Los Angeles facilities on Skid Row. There's other homeless healthcare facilities, but this is where they have their harm reduction center. Now, if you follow me, you know that I'm a big advocate of harm reduction. There's a video, search for Insight, one of my favorite places. And I just walk in here and I'm reminded, I've been telling Stephany Insight stories nonstop because I just so love the harm reduction model. Could you tell me a little bit of what you all do here? And you can include the wound care and the different things, because it's not just harm reduction. The building over here is a needle exchange harm reduction, and over here you even have acupuncture.
Yes. Yeah, so our whole agency is a harm reduction agency. It follows that model because that's what we're passionate about. That's what we believe here at Homeless Healthcare. And this site specifically is a syringe exchange site that offers sterile syringes on a needs-based distribution, meaning whatever you need. If someone comes in and has 20 to give us, which we safely dispose of, and they need 50 because they know they can't come back in a few days or for whatever reason, okay, we'll give you what you need. And that's actually very beneficial, the research has shown, along with safer injection supplies, tourniquets, sterile water, cotton balls, whatever is needed. And we're very, very big advocates of overdose prevention as well. So we distribute naloxone, and Narcan is the generic name, which reverses an overdose, an opioid overdose, which is common in this area. A lot of our staff here have saved lives firsthand too, which is amazing. We do everything free of charge for our clients, and it's all very low threshold programming. In addition to all of this, we do offer acupuncture and group and wound care. We see a lot of people who inject drugs. They come in with abscesses, and we take care of that for them. And if people are ready to talk about something else, like maybe they're looking to wean off opioid use, let's get you connected with MAT services, medication-assisted treatment, which is a drug replacement therapy to help people into treatment if that's what they're looking for. We never push anyone into treatment. That's not something we would ever do, but we connect you with whatever you're looking for. So that's what we believe here.
Why I love harm reduction personally is it's, to me, unconditional love. It's sometimes people, when they're abusing drugs, are not in right mind, and their human spirit and physical condition has just deteriorated. And harm reduction model just loves on people wherever they're at. They could be crawling in here on the ground or walking on 2 feet, and they still get love and support. Nobody is turned away. Where so often in homeless services, we put barriers up. We say, oh, you've got to be this way before we can help you, or you've got to act like this before you receive help.
Testing.
Yeah. And harm reduction says, you're a human, you have some problems. We want to make sure that those problems don't get worse.
No judgment.
No judgment. And if you want to get off drugs or change your life or have some other issues, we're here to help you go down that path too. This is not something that is advocating drugs, it's advocating life. And that's why I love harm reduction.
Hit it right on the head.
Yeah,
exactly.
And unfortunately, this country, I mean, needle exchanges, over the years have had to just fight for existence, and that's getting better. But it's still, you know, politically in your community, if you hear some kind of action about harm reduction, please support it. You know, not support harm reduction. Don't support getting rid of harm reduction. 'Cause these are health issues that affect the whole community, and you need to be aware of that.
All right. I mean, there's a lot of states that don't even have syringe exchanges as it stands now. We're hopefully, we're headed towards safe injection sites. It's looking like Seattle, San Francisco, Philly,
yeah,
LA. So I mean, that's where the future is headed. I think so.
Yeah, we were hoping our favorite mayor in Ithaca was going to start and have the first one. He was close. I know Mayor Myrick was really advocating for it, but I think Seattle or San Francisco might beat him, and it's so important. It's so very important. Anything else you would like to add for anybody out there about harm reduction or healthcare or the hygiene spot or the refresh spot?
The refresh spot. No, I mean, well, I'm just really grateful to be meeting all of you and for having me. And I think research and educating yourself is so important. People that are against harm reduction, it's mostly because they don't know about it. People that aren't supportive of safe injection sites or syringe exchanges, it's because they don't really know that there's so much data. I mean, these have been happening worldwide for decades. Research speaks for itself, and it shows so many different benefits for the community, for the individuals on all ends. So, educate yourselves and learn more and know about your community and support.
Yeah. Well, everybody, thanks so very much. Like this video, go watch a bunch of Invisible People videos, share them with your network. If you like this remote thing, I know I've been building on the live video stuff. And in fact, if you go and you look, we interviewed Kevin from Homeless Healthcare Baltimore a few weeks back live. It's one of the live interviews I did, kind of more professional in a studio way. This is the first time just putting a phone on some sticks and hitting live. If you like this, I'll try to do more, and we'll do more interviews. And thank you, Stephany, for having me. We're just trying to coordinate. Getting here was a little challenging, but you don't have to ask me twice to walk through Skid Row. I love this part of the city. It's just amazing, great people. So thank you, everybody.